Welcome back, everybody. That's a new episode of Ottolina English. I'm here with Francesca Patella, that everybody knows very well, and Matthew Reed. That episode is organized by Francesca, so I will leave her the floor for the presentation of our host and for the first questions. Please, Francesca.
Okay, today we want to talk about the GDR once again. The last time we talked about the emancipation of women in the GDR, we had Florentine Sandoval. Today we want to focus about the healthcare system in the GDR because we are really convinced that it still represents a good model to look at, especially in this very present moment where we are witnessing a financiarization of the healthcare. So today we have Matthew Reed, who belongs to the same group of studies of Florentine, that is IFDDR. And Matthew is also the author of an important paper that was published on the Tricontinental the last year, and that talks about the healthcare system in the GDR. So welcome, Matthew. Thanks for accepting our invitation.
Yeah, thanks very much for having me.
So I will start from the very, very beginning. What was the public health situation at the end of the Second World War?
Yeah, so I think maybe just to begin with, I think the very interesting thing about Germany, the history of Germany, is that, of course, it was split between the capitalist West and the socialist East. So it is very easy to compare the two different systems. And of course, part of those systems were the healthcare systems. And I think this is why looking at the history of Germany is actually so informative, even if we're not talking about Germany itself, but sort of what is socialist medicine in essence. Yeah. So the situation in Eastern Germany after the war was obviously very bad. I mean, the whole health infrastructure had collapsed. The German fascists had the policy of total war, so this meant that, of course, they fought to the last man all the way to Berlin. So all of the health infrastructure was destroyed. There was no medicine. There were diseases spreading uncontrollably. And one of the other big problems was that actually the physicians, the doctors, they were a very conservative profession. They actually always have been in history, if you look in other countries too. But this meant that in Germany, almost half of the doctors were actually also Nazi party members. And so you had the collapse of the healthcare system, and the occupation powers then had to, set up emergency healthcare in the early days. And as the years progressed, there was a sort of contrast in how healthcare was approached between the West and the East. And the policymakers in the East were largely communists and social democrats who had either been in exile during the fascist years or they had been actually in concentration camps. And they were then entrusted with the task of creating a new healthcare system that would be beyond the profit motive. So they wanted to separate healthcare from private economic interests because they recognized that this was actually a contradiction. You cannot have effective healthcare if it is oriented towards profit and private economic interests. So what we did in our brochure, in our publication, is we really tried to look at how they went about setting up this new healthcare system, also within this very difficult context of the post-war damage, but also sanctions from the West and the economic difficulties that the GDR faced from within. And I think we can maybe get into some of the ways they did this next, but it's a very informative historical lesson also for countries that have limited economic resources. And that shows you that, even in such context, you can create a healthcare system that is effective and it's also basically run for and by the working people. Yeah.
Clear. And to deepen a bit this topic about how the health system in DDR worked, can you start telling us what was the DDR approach to the healthcare, and how was the system financed?
Yeah, so I think the approach is based largely on a tradition in medicine, which is today called social medicine, which is basically, it sort of arose in the 19th century with the development of capitalism, where physicians, doctors, they started looking at what we call the social determinants of health. So what were the living conditions, the working conditions, and even things like our social relationships with one another, or the amount of free time we have, what we do with our free time. These are all factors that contribute to our health. And the idea is that it's not necessarily, or it's not alone the behavior of individuals that influence our health, but it's also our social context. And so the idea is you look at this social context and you try to address the risk factors for health within that context before illness actually arises. And this way you can basically have a very preventative approach to medicine, what they call prophylaxis. And this was kind of I guess the starting point for healthcare in the East. And the question was then, how do you actually create a system that is based around prevention, around prophylaxis? And the key here was firstly sort of nationalizing the healthcare institutions themselves. So gradually you had this nationalization of healthcare institutions like hospitals, but also the private practices where doctors provide outpatient care. This is sort of the care you receive outside of the hospital system. If you just visit your doctor in the neighborhood or in the city, these practices were gradually also nationalized so that doctors could be publicly employed by the state and provided with a reasonable income. And this basically helped them to liberate themselves from their economic dependencies on sick people, right? Because a private doctor who's working for themselves, they're actually dependent on sick people seeking out treatment and always coming back for treatment. And this is how the doctor then actually makes a living. And so if you are able to publicly employ these doctors, then they're no longer actually dependent on sick people, and they can focus on preventing disease, which in the capitalist system that we have today is, of course, less profitable than treating disease. So this was the first step, was nationalizing the healthcare institutions themselves. There were also various other benefits that maybe we can get into. But the second step was also creating socialist property relations in society more broadly. So if you can have nationalized workplaces, if the places where people work are planned by society as a whole, this means that you can actually prioritize health policies in all areas of life. So you can really have an integrated system where healthcare is really directly present in the workplace. So, for example, in the GDR, they had in large enterprises where there were many workers, they would have clinics and medical stations, which were overseen by the state health ministry and not by the company itself. So sometimes in the capitalist West, we have this similar kind of thing where companies will have their own healthcare system or their own healthcare facility in the workplace, but it's oftentimes connected to the workplace, and their objective is to basically make the employee once again go back to work so that they can make money for the company. And in the GDR, the workplace healthcare was actually independent of the enterprise itself, and so it was able to focus on the workers and making them healthy, and not so much for the private interests of the company itself. And that's just one example. There were also numerous other healthcare facilities in neighborhoods, which were also then very integrated into daily life, where you would have doctors, for example, going also to schools regularly to make sure that health was being protected from a very early age. And so you really had, I guess, to summarize, you had healthcare becoming no longer just an individual responsibility, but very much a social responsibility that is taken at all levels of society. Yeah. And in terms of how they financed this system, so the Soviet model was an inspiration for the GDR, obviously. They had built a socialist, very centralized, unitary healthcare system soon after the October Revolution in Russia or in the Soviet Union. And this was an inspiration in many aspects. For example, in the sort of centralization of the healthcare system, the GDR took over quite a lot of the mechanisms from the Soviet model. But in terms of financing, it was different, because in the Soviet Union, the healthcare system was financed almost exclusively from the state budget. Whereas in the GDR, there was actually a social insurance system where you would have a portion of your monthly wages would be going to the social insurance system. And this covered more than just healthcare. It was also pension, accident insurance, and this kind of thing. But it was also capped, I think, for workers, it was about 10% of their monthly wages were going to the social insurance system. And so it was in this way that they were funding the healthcare system of the GDR. So yeah, it's similar to the socialist system in the Soviet Union, but also there were these national specificities that are actually quite interesting to look at.
Clear. And what about the main challenges that this kind of healthcare system had to face?
Yeah, so I think to begin with, we have to understand the international context in which the GDR was operating. So, I mean, the GDR existed for 40 years, right, which is less than a generation. It's a very short period of time. And from the very beginning, it was an incredibly hostile environment that they were operating in, because there was obviously this very fierce competition with the West as part of the Cold War. And for the first 10 years or so, they actually also had open borders with the capitalist West. This was the front line of the Cold War, and the borders were open. So there were a number of issues involved in that. The biggest, one of the biggest problems was the so-called brain drain, where it was actually an active policy of the West to basically poach trained doctors from the East who had received tuition-free education. They were then poached by the West to attract them to leave the East and work in the West instead. And this basically meant that the GDR was losing a lot of resources and skilled labor to the West. So this was a big problem that the East tried to compensate with by making compromises with doctors and sort of slowing down some of the wide-ranging transformations that they were pursuing in the socialist healthcare system. So, for example, this transition away from the private practice model, there were lots of there was a bit of resistance towards that, because there was this very sort of traditional sense among doctors that, okay, they practice in a private practice, and they don't want to necessarily be publicly employed in a larger polyclinic where they're working with other doctors and things like this. And so there was this kind of resistance to it, and this had been something that existed before the GDR as well. There were these sort of conservative doctors' associations that always resisted any kind of reform of the healthcare system. And so what the GDR did is they tried to make compromises with the doctors by slowing this process of public nationalization, and saying that, for example, doctors could pass their private practice on to their children and so on. And so this was a way of kind of slowing the migration of doctors to the West, but also they were training sort of new generations of doctors as well. So particularly out of sort of working class families or peasant families, they were putting them into university and teaching them, giving them a medical education. And these younger doctors were actually much more willing to go into public employment than private employment, because there were a number of benefits. You had a secured income, you had paid holidays, you didn't have to worry about the bureaucracy of running your own private practice and so on. And so there were these multiple approaches to try to curb this issue of losing doctors to the West. This was probably one of the biggest issues, and another one was just the sanctions faced by East Germany. So from the very beginning, the West applied pretty heavy sanctions to the East, which meant that they couldn't import medical technology and equipment. And there were also oftentimes shortages of just basic medical supplies, especially in the early decades. Bandages, syringes, and so on. They often had to be sanitized and reused. And so we talked with, during our research, we talked with nurses who described pretty difficult conditions, especially in hospitals where they're, reusing implements and having to, sanitize these implements between their patients, and very difficult situation. And if you look at the health indicators, you see that too. There at the beginning, there's a much higher infant mortality rate. So more children are dying at birth than in the West, quite a few more actually. But this is one of the astonishing things about the GDR, is that in a very short period of time, so just 4 decades, they're actually able to really close this gap quickly. And so from a much weaker beginning position, they're at the end, by 1990, they're very much sort of on level with the industrialized states in the West in terms of these healthcare indicators like infant mortality and tuberculosis, and the amount of doctors per inhabitant in the country and so on. So you see this very difficult context that the GDR is in, and these challenges that it's facing. It's able to sort of overcome them by developing this socialist healthcare model, which just had a very different approach and enabled this achievement, I would say. Yeah.
So let's come to my favorite topic, the polyclinics. It's a topic I really care about because, during the pandemics, we faced a failure of our healthcare approach, because in Italy, we are seeing a cut of territory outpatients. And while we are we have great hospitals, but very poor territory healthcare. And I really think that funding the territory healthcare without reforming general practitioner activity is completely nonsense. Because now in Italy we have these general practitioners that are private. They are paid by the regions, but they work as private employers, actually. They're not really employed by the state. I'm a doctor and I'm employed by the state because I work in a public hospitals. Mm-hmm. But general practitioners are not paid by the hospitals. They are paid by the regions, and they work as private practitioners. They can decide how many hours work in a day. So it's a different activity. And what I think is really nonsense is they work alone, because this is something that could work at the beginning of the 20th century, but it cannot work now, because medicine is now cooperation. You have multiple choice, both in diagnostic or therapeutic strategies. So no one can know everything. Mm-hmm. Can know everything. This is the truth. So we need to work together. We really need to work together. So I always say there should be some outpatient infrastructures that allows general practitioners to work with other colleagues, such as radiologists or laboratory doctors or other kind of specialties. And reading your notebook, I discovered that this was a reality in the DDR.
Yeah, so this is a very interesting topic, I think. It's also something that was not exclusively an idea in the GDR. It had actually been discussed in the 1920s and 30s in Germany as well, because they did recognize that, as you said, this model of sort of general practitioners working in their private practices, this is just actually not, it's no longer appropriate for modern medicine to treat patients in this kind of system. But I think to just take one step back, what you were talking about in terms of, there are hospitals that are good, but the sort of territorial healthcare, outpatient care is privatized and not so efficient. And I think that this also gets to something that is interesting about the GDR system and socialist healthcare systems in general, is that what they actually overcame also was this fragmentation between publicly owned and quite efficient services on one hand, and then the private sector on the other hand, which is sort of running, for example, outpatient care and private practices and so on. But it means that you have these two kind of parallel worlds that are not exactly working together, And in the socialist states like the GDR, the Soviet Union, you had a very unitary system. So all of these healthcare facilities were actually publicly owned, and they were directed then by the various levels of government, at the regional level or at the federal level. But it meant that you had a very sort of integrated, holistic approach to healthcare on a society level. So all of these healthcare facilities were actually had the same system and were cooperating with one another. Not just hospitals, but the hospitals were cooperating with polyclinics, and they were cooperating with pharmacies, and they were cooperating with research facilities. And this meant that, for example, if a patient needed a medicine and the pharmacy didn't have that medicine available, then they could discuss directly with the doctor which medicine is an appropriate substitute for that instance. So there was really a much higher degree of integration than we have in this sort of fragmented and patchwork healthcare system in the West today. And yeah, so to return to the idea of the polyclinic, this is really, I think, you could call it the culmination point of the transformation of healthcare in the GDR, and I think in many other socialist states too. And the basic idea behind it is, as the name suggests, a polyclinic is basically a clinic with multiple clinics in it, multiple specialities. So you have the general practitioner working in the polyclinic, or several even, but then you also have other departments like, you have dermatology, skin doctor, or you have a pediatrician, the doctor for children, or you have, various other specialists working in the polyclinic, and you also have then a common laboratory that they can all use, and the equipment, X-ray machines and so on. This is all housed in one polyclinic, which means it's much more efficient, right? Because if a general practitioner has a case, he doesn't know what's going on, he needs to maybe do an X-ray, then he can do it in the same building without sending the patient somewhere else. You cut down on a lot of this, of the waiting times, and also of this bureaucracy of being transferred from one institution to another. And the patient doesn't have to take care of, CDs or files with all of their information on it, because this is sort of jointly managed by the polyclinic itself and the healthcare system. And so this has a number of benefits, practical benefits for the patients, obviously. Opening hours are longer in a polyclinic because there are just more doctors there. There are also substitutes. So if the doctor's sick or on holiday, the practice doesn't have to close down, but the polyclinic is still open. And this also meant that, for example, doctors could do on-site visits, for example, because they didn't have to close their practice if they were traveling. So they could travel to schools or to kindergarten, and they could actually do regular checkups on children there while the polyclinic stayed open for walk-in patients there. So there were these sort of benefits, but then also in terms of the care itself, if you have, as you said, doctors working together under one roof on cases, different specialists, then you can actually have a much more holistic approach to individual cases. And you can also really integrate these various levels of healthcare, right? So the prevention, the therapy, and aftercare, you can actually really integrate this treatment or this sort of handling of a case, if you have these doctors working together at these various levels. So you not only have these practical benefits, but also very much health benefit, medicine from a medical point of view. It's just a much more efficient way of going about it.
Yeah, absolutely. And we were talking about children, so we wanted to ask you also something about the educational system in the DDR. If can you say something to us?
Sure. So yeah, the healthcare was very much integrated into schools as well, and also various other childcare facilities. In, like as I said, in kindergarten and so on, you would have regular visits from pediatricians, from doctors who specialize in child medicine, and these were also then organizing things like vaccinations, which I'm not sure how it's done in Italy, but here in Germany, the policy these days is that vaccinations are very much something that the parents have to organize and they have to keep track of. And there's kind of an opt-out system. So you have to actually really ensure that your children get vaccinated, and you have to follow up on it yourselves. You have to make appointments and so on. And the way that it was done in the GDR, and I think most other socialist states, was that it was kind of an opt-in system. So, young children would be opted in for vaccinations, and they would be also provided in the childcare facility, and also looked out for by the teachers and the doctors. So it was, again, not so much a burden for parents. It was not an individual responsibility, but more of a social responsibility that was looked after by multiple actors in society. And maybe just to also add to that, there's also this idea that people were forced to be vaccinated, which was not true. There were actually ways that parents could have their children exempted from vaccines for religious reasons or whatever. But it was, the system was built on a very scientific approach that said, okay, no, vaccinations are actually a good thing, and we have tested them, they're safe, and it's our job as the state to provide effective vaccines to everyone, regardless of their income and their social status and so on. And so there was this vaccination system, which was very effective. And to this day, you actually see, interestingly, that the willingness to be vaccinated in East Germany for most things is actually higher than in the West. But when it came to COVID vaccinations, it was much lower in the East. And I think that says a lot about the fact that it was not necessarily anti-vaccine concerns, but just the way that the pandemic itself was handled. And so I think it's interesting to see, 30 years later, that we still see this difference in that regard. But that was just one aspect of healthcare in the education system. You also had dental care, for example, was taken care of in the childcare facilities. This is, again, something that's different in Germany. I'm not sure how it is in Italy, but here dental care is something that you really have to pay for yourself as a parent. And it's something,
Italy.
yeah. And parents have to, organize it for their children as well. And in the GDR, it was first publicly funded, so all children had the opportunity to develop healthy teeth regardless of their parents' income. But it was also, once again, a social responsibility. So it wasn't just up to the parents to organize it, but teachers were looking out for it, the doctors were looking out for it. And yeah, there was a big effort to also reach the more rural areas of the GDR as well. So they actually had sort of mobile dentist vans that would go around the rural areas, looking and providing care for children living in rural areas, to make sure that they also had a really preventative care for their dental health as well. So yeah, these are just several of the areas in which you can really see. This is what I was trying to talk about earlier, is this integration between healthcare and all other areas of society.
Yeah, of course, because Actually, a real healthcare should be preventive. This is the very best way to care about your people, about their health, because and we can see it also in Cuba, because in Cuba they have this embargo that doesn't allow them to really have they don't have so much resources, so it's hard for them to provide really the infrastructure, good infrastructure for their people. But preventing disease, they made half of the work, I think. So in Cuba they have multiple vaccinations. They have, it's incredible because they have an industry of vaccines that is more developed than in Europe. And people do it because, as you said, if healthcare is separated from private interests, people trust a little bit, actually more, in the vaccination, because I think that this fear of vaccination that we faced also in the pandemic is also caused by the fact that a lot of people thought that vaccination was were done for the profit of this corporation. And actually it was a little bit like that, because we saw that in this case the vaccines weren't appropriated to be sold in the global south, which is a completely nonsense strategy, because if you have a pandemic with a global spread, you should vaccinate everyone in the world. But they didn't do it because they favorite the profit. And that's, I think, what in the GDR didn't exist. And that's why the vaccination rate were very high in the GDR.
I would completely agree with you. I mean, I think you had these pretty ridiculous scenes here in Germany on television as well during the pandemic, where the CEO of these vaccine or these pharmaceutical companies, he would come on and say, you're going to have 4 or 5 boosters of this vaccine, and he's not a doctor. He's the guy who's making money out of this vaccine, and it's supposed to sort of encourage people to get these boosters. But of course, everyone knows that, well, he has an economic incentive, a financial incentive, to tell us this. And so it's just not a very this is the problem, when you bring in private economic interests to medicine, you're never sure anymore what is a medical decision and what is a decision to make money. We have the same thing here in the hospitals in Germany now. We have a system called diagnosis related groups. It's something that they imported from the West, from the USA mostly, and it basically categorizes health illnesses based on what's billable. So what can the insurance company charge for certain illnesses. And it means that if your illness is in a higher category, it means that they can bill more, then you're a higher priority. So in the hospitals, you're no longer being prioritized not by your medical condition alone, but also by what's profitable. And this is the problem. When you don't separate private economic interests from healthcare, you do get a degeneration of the medical field, I'd say. And in terms of what you were saying at the beginning, I think that this is, in Cuba, they're in this incredibly difficult context, also because of this embargo against the island. And this is sort of one of the advantages of preventative care, prophylaxis, is that you can relatively economically, you can actually ensure that the health of the population stays quite high, because you don't have to have these expensive treatment options, or you do need them for those instances where people, for genetic reasons or whatever, they develop illnesses. And it is a big problem in Cuba, and it was in the GDR as well, is that they didn't have access to the latest technology and equipment. But if you are focusing on prevention, you can actually save a lot of resources, of society's resources, because you're not relying on expensive treatment, but you're just sort of doing daily prevention, which is just a lot cheaper and uses far fewer resources in the long run. So yeah, I think that this is why at the beginning I was also saying, for countries, especially sort of those countries in the global south today that are in a difficult economic situation because of neocolonialism and so on, the example of socialist healthcare from states like Cuba and the GDR or the Soviet Union is actually a very interesting historical model to look at.
And to conclude, if you agree, Francesca, I wanted to ask you, Matthew, something that has more to do with your general work that you are trying to do with Tricontinental. That's, if I good understood, has to do with the attempt to spread a different view of DDR in general and the socialism in general in Germany, but not only in Germany and especially in Berlin. And I wanted to ask if do you have the feeling that you are in a way succeeding in this kind of spreading? And if I don't know if you think that in the next future this kind of ideas, this kind of cultural work can have a kind of a success, or do you think that will be very difficult?
Well, yeah, so this is kind of one of the core values or principles, leading principles of Tricontinental, is this idea of what we call the battle of ideas. It's very much a kind of ideological dispute about the situation in the world today and how we understand history and how we understand the future as well. And so it's a sort of a fight over ideas. And so part of our research into the GDR is, to basically reclaim this history as our own. And, that doesn't only include the positive sides of these experiences, but also the negative sides. We want to learn why the socialist camp collapsed in 1990. What internal factors led to that, and why were people also why did people go to the streets in Germany in 1989 and so on. So these are all things that we want to understand, and these are all things that we see as part of the battle of ideas. In terms of successes, whether we can talk about that now and maybe in the future, I think there are two very different contexts. So I definitely noticed that there's a big difference when one's talking to a German audience or an international audience. In the German audience, there's a very, very dominant sort of anti-communist narrative where it's very difficult to have a calm, rational discussion about the GDR. It becomes very emotional very quickly. And this is something that they really, I think, hammer in at school, but also people who have grandparents who perhaps have had certain experiences in the GDR. They have different views. We also we do interviews with many people who have very positive experiences in the GDR. So it's something that's very emotional, and we're working to really try to research this history on a scientific basis, on a very rational basis, look at the shortcomings and the achievements, and make it accessible to an international audience. And in terms of an international audience, I can definitely tell that there's more room to discuss this now. And I think especially there's this sort of generation who didn't grow up with the Cold War propaganda, and they're more willing to explore alternatives. I think many young people they can see now that the current system we have is not working, and it's worth exploring other systems, even if they also cease to exist at some point. It's worth looking at them at least. And so it's definitely easier talking to younger people, also more international people. especially also people from the global south, because the view of the GDR is actually quite a positive one, because there was a lot of support for the anti-colonial movements and so on. So yeah, I think this is the current situation. And in terms of the future, yeah, I mean, we're going to keep working on this research and hope that it will get easier. I think because of the way the international developments are working right now, the situation here in Europe, or at least in Germany, is going to get more and more difficult, actually. But I think internationally it will be perhaps easier to discuss these topics, and there will be more interest in it, I think, as well, as people really look for alternatives to the current order, and try to understand that the way things are right now, they don't have to be this way. And actually, there were systems in the past that worked, and there can be systems in the future again that work beyond the profit motive.
Sure. Do you have a last question, Francesca, or?
No, we can
Okay.
finish now.
Okay. Can I ask you just one last thing, Matthew, if you have 2 minutes? Because I was interested in a bit on the German political situation right now, and linked to what you were saying. Can we say that people that actually lived under the DDR in the East Germany now are a kind of are preferring parties like, I don't know, FD or Sarah Wagner parties that are in some way more related to that kind of political experience from people from the West that still votes only CDU, SPD. Do you also see this kind of situation? Can we say that it's some way right or not?
Yeah, I would generally agree. I think, I mean, there's a huge voting difference between the West and the East in Germany. It's one of the many ways you can see differences between the East and West that continue to this day. Interestingly, in the East, for many years, the party called the Party for Democratic Socialism, which succeeded the ruling party in East Germany, in the GDR, they were receiving many votes. They were oftentimes, and sometimes they still are, the strongest party in the regional parliaments. And these were sort of the forces who said, okay, we don't want to get rid of socialism in the GDR. We want to improve it. This is why they went on the streets in 1989. They said, we want to improve socialism. We don't want capitalism. But this was kind of then brushed aside by West Germany when they moved in, and they implemented their own system. And so this party is still got quite a bit of support, although it must say that it's now fractured between the new Bündnis Sarah Wagenknecht, which is really criticizing the Party for Democratic Socialism, or what's now called the Left Party, because they're sort of more focused on social issues than on working class issues. And so this kind of fracturing of the left has definitely divided these forces. But the AfD, has to be said, the far right is also very strong in the East. And this has to be understood, I think, also in the context of the deindustrialization that happened after the collapse of the GDR, that the neoliberalization of East Germany caused a lot of issues, and there's just a very sort of culturally a very arrogant issue or attitude towards the East as well. That we will tell the East Germans about their history, and we will tell them how to understand their history, and we will tell them how to go forward now as well. And there are all kinds of issues, like income is much lower in the East than in the West to this day. The amount of savings is much lower, and so on. So there are lots of economic issues that I think are feeding into this this issue. But I mean, there are other interesting studies. For example, last year there was a big study from Leipzig, at the University of Leipzig, where they showed that actually 2/3 of East Germans experience a longing for the GDR. I think you can interpret that in different ways, but it's something that caused quite contentious debate, especially in West Germany, where people, they can't understand this, because they think, for them, everyone in East Germany was oppressed and repressed, and they don't understand why this is a phenomenon. And I think this is part of the problem, is that there's just an ignorance towards the East and the GDR. At times it's a willful ignorance, but it's feeding this divide between West and East Germany to this day.
Thank you, Matthew, for this interview. Thank you for all your work, and wish you luck, of course, to you and to Tricontinental for this battle of the idea and this fight against cultural hegemony and West propaganda and ideology. We are trying to do a bit the same work of yours here in Italy. Thank you, Francesca, and thank you everybody for listening to us, and see you in the next episodes.
Bye.
Thank you.